Why vital signs matter? Vital signs tell us how the body is working. They give early warning signs when something is wrong. CNAs are often the first to notice changes in a patient's condition. Knowing how to take vital signs correctly and recognize abnormal results helps keep patients safe and helps nurses and doctors make quick decisions. What are vital signs? Vital signs are basic measurements of how the body is functioning. The main vital signs include temperature, pulse or heart rate, respirations, also known as breathing, blood pressure, and oxygen saturations or O2 sats. Let's begin by talking about the body temperature. Body temperature shows how warm or cold the body is. It helps identify infections or illnesses. The average body temperature is 98.6 degrees Fahrenheit or 37 degrees Celsius. But typical body temperatures can range anywhere between 97 degrees Fahrenheit up to 99 degrees Fahrenheit or more. What's important for you to know as a caregiver? Anytime someone has an elevated temperature, we call that a fever. And a fever may indicate infection. So always report temperatures that are outside the normal range to your nurse. Next, let's talk about the pulse or the heart rate. The pulse measures how fast the heart is beating. It can be felt at the wrist, that would be the radial pulse, or the neck, which is the carotid pulse. For an adult, and your CNA examinations usually focus on adult patients or residents. So for an adult, the average range is 60 up to 100 beats per minute. What do you need to know as a caregiver? Fast pulse rates may mean pain, fever, or anxiety, while a slower pulse rate may occur during sleep or with some medications. Regardless, as a caregiver, you're going to report any irregular, whether it's fast or slow pulses or heart rates. Respirations or breathing. Respirations measure how many breaths a person takes per minute. A normal adult would breathe 12 up to 20 breaths per minute. And for caregivers, you must watch the chest rise and fall for 1 minute, no cheating. Fast or slow breathing may mean illness or distress. And now let's talk about the blood pressure basics. Blood pressure measures how strongly blood pushes against the artery walls. The blood pressure has two numbers. The systolic is the top number, and that number reflects the pressure when the heart is pumping. The bottom number is referred to as the diastolic pressure, and that is when the heart is at rest. Those two numbers have ranges, but let's talk about the normal adult blood pressure first. It should be less than 120 over 80, and the mmHg stands for millimeters of mercury. How much pressure we put into the cuff, or how much pressure is within the arterial wall. So 120 over 80, that would be systolic/diastolic. Here are some more parameters that you should know as a CNA, as a nursing student, or as a caregiver. Remember, we want that blood pressure to be less than 120 over 80, but not too low. Anything that's higher than 130 over 80, we're now considering that hypertension. That's right. As of 2025, the American Heart Association and the American Cardiology Association, they changed the rules. So 130 over 80 and above would be considered a higher blood pressure. However, your nurses and your medical staff, you may not see us treating it as if it's a critical blood pressure, but we need to be monitoring it. Now, let's talk about when someone's blood pressure is less than 90 over 60. Well, that pressure is just a bit too low. So when I told you that we wanted it less than 120 over 80, we don't want it so low until the person doesn't get adequate blood flow to their brain. They'd be dizzy. And so as a CNA, we don't expect you to know everything. We just need you to know what the normals are, how your patient is presenting, and if there are any changes, you're going to let your nurse be made aware. So here are some important notes for caregivers. High blood pressure can damage organs. Low blood pressure would be the lack of blood flowing to the brain. That can cause dizziness, which could cause a fall. And whenever you're taking a blood pressure, you have to use the correct cuff size. If not, you can get false high or false low readings. Additional information that you must know as a caregiver is that we never take blood pressures on arms with IV lines unless the nurse is giving you permission. The dialysis fistulas, or we call it an AV fistula, which is pictured here in the image. A rule of thumb that I always tell people is if you don't know, ask. If the arm doesn't look normal, you probably shouldn't be doing a blood pressure there without asking a nurse first. If someone's had a recent surgery on their arm, or maybe they had a mastectomy, they had some of their breast tissue removed, whatever side that tissue was removed on, we usually do not take blood pressures on that arm. And then lastly, if someone has a severe burn or some type of sore, maybe they have a skin tear on that arm, you want to think twice before you use that arm for a blood pressure. Orthostatic hypotension. Orthostatic hypotension is a drop in blood pressure when a person changes position, such as moving from lying down or sitting to standing. Common signs and symptoms are dizziness, lightheadedness, feeling faint, and blurred vision. As a caregiver, you must know that orthostatic blood pressures can increase the risk for falls, and it often happens in older adults or dehydrated patients. Report symptoms and abnormal blood pressure readings to your nurse, and always assist patients to change positions slowly. You'd have them sit at the edge of the bed for a minute or two before you ask them to stand. So no quick or sudden movements. Oxygen saturations, or for short, we call that O2 sats. Oxygen saturation means how much oxygen is in the blood. It is checked using a pulse oximeter placed on the finger. And the normal average adult O2 sat is between 95 up to 100%. As a caregiver, you must know that oxygen levels less than 92% may be a concern. So anything that's abnormal, remember, you're going to report that to your nurse. Low oxygen saturations can cause shortness of breath, confusion, or fatigue. That means they're weak. Make sure the finger is warm and clean. You won't get a good reading otherwise. If necessary, remove any nail polish because the darkened color on the nails would prevent the pulse ox from reading the O2 sat. And then, as we stated before, report low oxygen levels immediately. Remember, you are part of a healthcare team. If you see something, say something. That is going to help to keep your patient safe. Why do vital signs change? Like, why, if you look at a heart monitor, why does the heart rate go from 86 to 84 to 90? Why does it change so much? Number one, your patients move, they cough, they breathe. And so the body actually reflects those different stressors. So vital signs can change due to pain, fever or infection, anxiety or stress, exercise or activity. And if you have someone who is sick or elderly, them just moving in the bed would be activity that can cause the heart rate to raise temporarily. Medications can also affect vital signs, dehydration, breathing problems, and the list goes on and on. Your responsibility as a caregiver is to take accurate vital signs. If you don't know how to do something, say something. Someone is willing to teach you. We'd rather teach you so that you know what you're doing and the reason why, you may, change your technique or may need to improve your technique versus you continue to do it incorrectly and give us inaccurate numbers. Once you take the vital signs, don't forget to record them. You have to document. Remember, if you don't document it, we have no proof that you did it. You have to know what the normal vital signs are. If you don't know what normal is, you won't be able to report it to the nurse when something is abnormal. Report changes promptly. Look, you can save a patient's life by getting that nurse into the room. And then observing your patient's condition during vital sign checks. So when you're going into the room to do vital signs, it's not just about equipment and putting a thermometer in someone's mouth or putting a cuff on their arm. Ask how they're doing. Do they need anything? Do they need to turn? Maybe this patient who was previously responsive is no longer talking to you. So when you go in and you do your vital signs, you also have to communicate with your resident, make those observations, and let us know if there are any changes. Key takeaways, and I love giving takeaways. Vital signs are more than just numbers. Remember, we don't treat monitors, we treat people. There's a person attached to that monitor. So, vital signs tell a story about the patient's health. Accurate vital signs, not you guessing. We don't need a guesstimate. Accurate vital signs help save lives. So whether you're a home health aide, a CNA, or a nursing student, your role is critical in early detection and patient safety. Before we begin our practice test, let's just go over some of the common terminology and abbreviations associated with vital signs. So VS would be vital signs. T would be the abbreviation for temperature. BP is the abbreviation for blood pressure. Sometimes your nurse is only going to ask you for the systolic blood pressure, the SBP, that top number. So you wouldn't say 120 over 80 if the nurse says, hey, what's the systolic blood pressure? You would just say 120. The diastolic blood pressure, or the DBP, is the bottom number. Heart rate or pulse, HR or P, are sometimes used interchangeably in the healthcare field. So you can use either. And then RR is the abbreviation for respiratory rate. Continuing O2 sat or SpO2. That's how we relate or refer to oxygen saturations. This is not something you should continue using, WNL, within normal limits, but I put it here because you may still see it in some charts. I don't know what within normal limits are, because was it normal for your patient? So, just state the facts. You're going to state your observations objectively, so based off of the measurements and not off of subjective data, things that you feel. Okay. Hypertension, HTN, refers to high blood pressure. Hypotension doesn't have an abbreviation, but hypo, remember that prefix refers to lower than normal. So hypotension refers to low blood pressure. Tachy is fast. Tachycardia, fast related to the heart, would be a fast heart rate. And Brady, think of the Brady Bunch, all of those family members and kids in an old school station wagon. It wasn't going too fast. So bradycardia refers to a slow heart rate. Tachypnea, say that with me. Tachypnea refers to fast breathing, and bradypnea, we don't usually say that word a whole bunch, but bradypnea refers to slow breathing. Remember, tachy is fast and brady is slow. All right, you all, we've done our review. I hope you're excited. Let's get ready for the practice test. Before we begin, I want you to find a quiet space to focus. Have a notebook or scratch paper ready. We're going to read each question carefully, and we're going to trust our instincts. That's right. We already have the heart for patient care. And so many of you ask for our slides. You want to know, hey, Miss Eunice, Nurse Eunice, can I get the questions that go with that particular practice test? Well, you all can do so. If you go to the link that's in the description, you can download our vital signs bundle, and you can receive this practice test and so much more. All right, you all, let's get started. Question 1. Which of the following is considered a normal range for an adult's resting heart rate? Is it A, 40 to 60 beats per minute? B, 60 to 100 beats per minute, C, 100 up to 120 beats per minute, or D, 120 up to 140 beats per minute? Please put your answers in the chat. All right, and this is a quick review tonight, so I'm only giving you about 5 seconds to enter your responses. So 3, 2, and that is right. If you chose B, congratulations. You understand that a normal resting heart rate for adults is typically between 60 and 100 beats per minute. Anything outside this range may indicate bradycardia or tachycardia. Question 2. What is the most common site for taking an adult's pulse? The most common site. Is it A, radial, B, femoral, C, temporal, or D, carotid? I know this one's tricky, but I'm looking at so many correct responses come through. So it's not tricky for you. You know that the most common site for taking an adult's pulse would be A, the radial artery. So the radial artery, which is located at the wrist, is the most common site used for taking a pulse due to its accessibility and ease of use. Question 3. Which blood pressure reading is classified as hypertension? Is it A, 110 over 70, B, 120 over 80, C, 130 over 80, or D, 150 over 95? Stop trying to give me two answers, but I will accept two answers. So for this one, the one that is most concerning is going to be D, 150 over 95. Now, the blood pressure of 130 over 80, while it's on the higher end, it's not considered hypertension until it's greater than 130 over 80. So I tricked you on that one. Let's go to number 4. A CNA is caring for a patient who reports dizziness upon standing. What is the most likely cause? Is it A, orthostatic hypertension, B, orthostatic hypotension, C, tachycardia, or D, hypoglycemia? Oh, I am so proud of you. You all are some awesome caregivers. Yes, it is B, orthostatic hypotension. So that occurs when blood pressure drops significantly upon standing, leading to dizziness or lightheadedness. Question number 5. What is the normal range for the adult respiratory rates? Would it be A, 10 to 14 breaths per minute, B, 14 to 22 breaths per minute, C, 12 to 20 breaths per minute, or D, 22 to 28 breaths per minute? And congratulations on everyone who has taken their exams and passed. I see so many great comments, and I also want to say congratulations in advance to those who are going to be testing soon. I am so proud of you. The answer is C. That is right. 12 to 20 breaths per minute. That is the normal range. Rates outside of that range may suggest respiratory distress. Question 6. A temperature of 102 degrees Fahrenheit is classified as which of the following? Is it A, hypothermia, B, normal, C, afebrile, or D, febrile? Some of those terms I did not introduce to you in the preview or review. So let's see if you can figure out the correct response by a process of elimination. And yes, you can. Yes, you can. Remember that anytime the prefix A is in front of a medical term, that will be the lack of. So C is afebrile. That means they have the lack of a fever, which is the opposite of D. Yes, D is febrile. That temperature is elevated, or they are hyperthermic. So a temperature of 102 indicates a fever, also known as being febrile. Question 7. What is the best position for a patient who is experiencing difficulty breathing? Is it A, supine, B, prone, C, Fowler's position, or D, Trendelenburg? And I know some of you are like, well, Nurse Eunice, why did you include that question? It has nothing to do with vital signs. Yes, it does, because as a caregiver, when someone is having abnormal vital signs, I need for you to know what to do until the nurse gets there. So, if your patient's having difficulty breathing, are you just gonna watch them? Absolutely not. You're calling that nurse, and while you're waiting for that nurse to get into the room, if the patient can tolerate it, you are doing C. You're putting them in a Fowler's position. So I don't know why we just don't say sit the patient up. Just pass your test and learn these words. All right. So the Fowler's position means sitting upright. It helps to ease breathing by allowing the diaphragm to expand fully. Question 8. A bedbound patient with a low blood pressure, excuse me, I gave you the answer. A bedbound patient with a blood pressure of 90 over 60 is experiencing which of the following conditions? Is it A, hypertension, B, hypotension, C, bradypnea, or D, hypertensive crises? I know those are Freudian slip. I wasn't trying to give you any answers. So revealing the correct response in three, two, and yes, that blood pressure indicates hypotension. So a blood pressure reading of 90 over 60 is considered low. Stop laughing at me. Question 9. Which of the following symptoms may be associated with bradycardia? Is it A, shortness of breath, B, dizziness, C, chest pain, or D, all of the above? So think about it. When someone's heart is beating slowly, do they have enough blood flow circulating to their organs? Do they have enough blood flow circulate into their brain? What is carried in the blood? If you said oxygen, you're absolutely right. So that is right. All of the above, it is D, because if they have low blood pressures, that means that there's not enough blood going to the brain that will cause dizziness. There's not enough oxygen circulating. So that would be the cause of some of the shortness of breath. And yes, if they don't have enough blood flow going to the heart, they can also have chest pain. So I know you're going to call your nurse, but we need to let you know what's happening with these patients. Question 10. When taking an oral temperature, the CNA should wait at least how long after the patient has eaten or had a cold drink? Would it be A, 30 minutes, B, 20 minutes, C, 15 minutes, or D, 10 minutes? I had to look this one up too because I answered it incorrectly. Yes, we're all over the place. We have A's, B's, C's, and D's. So, according to the Mayo Clinic, now you look at your school's resources, but according to the Mayo Clinic, it is A, 30 minutes. It is recommended to wait at least 30 minutes after a patient has eaten or drank to ensure an accurate oral temperature. And so I know what the Mayo Clinic says. You follow your facility's protocols. And when in doubt, ask your instructor or your professor for more guidance. Question 11. Which of the following pulse rates is considered tachycardia in an adult? Is it A, 50 beats per minute, B, 75 beats per minute, C, 99 beats per minute, or D, 120 beats per minute? Great job, team. You're not going to let me trick you twice with those high normals. So it's not C because even though it is 99, that would still be in the normal range. It's between 60 and 100. So the one that will represent tachycardia would be the one that's greater than 100. That would be D. So pulse rates above 100 beats per minute would be considered as tachycardia. And so on the monitor, you can see a strip that looks like this. It's going to be nice and tight, but it's going to be fast. Remember, we don't treat monitors, we treat patients. So when you see something abnormal, you can go ahead and press that button and say, hey, can you get Nurse Elizabeth in the room? And then you're going to talk to your patient. Make sure they're okay. Don't let them get out of the bed. Put the cuff on them, etc., etc. All right, let's go to our next question. Question 12. A CNA is preparing to take a patient's blood pressure. Which arm should the CNA avoid using? A, an arm with a small bruise. B, an arm with an IV infusion. C, an arm with a healed scar. Or D, an arm the patient prefers. You are absolutely correct. It is going to be B. Unless that nurse tells you otherwise, you do not take a blood pressure in an arm that has an IV. So blood pressure should never be taken on the arm with the IV without first checking with the nurse because it can affect circulation and cause inaccurate readings or harm to the IV site. You don't want to be the CNA who blows the patient's IV because you put the blood pressure cuff on the same arm that has an IV site. No one's going to like you that day, except for me. I'm going to love you because I'm still going to say, I told you not to do that. All right, 13. A patient reports feeling lightheaded when moving from lying down to standing up. What should the CNA do while waiting for the nurse to arrive to the room? Is it A, elevate the patient's legs? B, take the patient's blood pressure? C, assist the patient to walk around? Or D, ask the patient to remain in bed? I know this was a good question. I like this one. It has you thinking, like, what do you do first? They were laying down, you stood them up, and they got lightheaded. What do you do first? For everybody who chose D, you're right. They got to get back in that bed. Mr. Lucas, you're in the bed. So the patient's symptoms are consistent with orthostatic hypotension, which can cause dizziness and increase the risk of falls when standing. While waiting for the nurse to arrive, the CNA's priority is patient safety. Asking the patient to remain in bed helps prevent injury. And then you can do all that other stuff. You know, you can put the blood pressure cuff on the arm. You can elevate the legs if the nurse advises you to do so or asks you to do so. But first, let's get that patient back to safety because if we keep them standing or we keep them sitting at the side of the bed, they can become dizzy and they can actually hurt themselves. They could fall. 14. A CNA counts a patient's respirations at 28 breaths per minute while the patient is resting. How should this be interpreted? Would that be A, normal breathing, B, bradycardia, C, tachypnea, or D, hypotension? Yes, team. Yes, that would be C, tachypnea. Tachypnea means fast breathing. Normal adult respirations are 12 to 20 breaths per minute, so 28 is above normal and should be reported. 15. How long should the CNA count a radial pulse to ensure accuracy? Is it A, 10 seconds and then multiply the number counted by 6? Would it be B, 15 seconds and then multiply the number by 4? C, 30 seconds and then multiply by 2? Or D, would the CNA count for 1 full minute? And remember, when you're taking your CNA test, you have to get rid of everything that you already know. Everything you see in those hospitals and nursing homes, because more than likely they are not done by the book. They're not done correctly. They're done the fast way, but it's not the safest way or the most accurate way according to textbooks and research. So the answer is going to be D, 1 full minute, whether it's irregular or not. You're going to count the radial pulse for 1 full minute. So counting the pulse for 1 full minute ensures an accurate reading, especially if the pulse is irregular. And think about the population of patients you're caring for. They have heart conditions. They can be missing heartbeats. And we call that having a skip beat. And of course, you would, be able to see that if they had their heart monitor on, but you can sometimes feel that whenever you take a pulse. So, but you won't feel it if you only count the pulse for 15 seconds. So, you taking a pulse for 1 full minute would help us to, detect things that could be going on with this patient. 16. When measuring a patient's respiratory rate, the CNA should do which of the following? A, inform the patient that you are counting their breaths. B, measure right after taking the pulse without the patient knowing. C, count respirations for 15 seconds. D, ask the patient to take deep breaths. And everybody got it right. It is B as in boy. So respiration rate should be measured without the patient knowing. You have to keep the element of surprise, as they may alter their breathing if they are aware. So oftentimes, and whenever you watch our all CNA skills step-by-step video, we do have a video that talks about how to take respirations, how to take a pulse, and we're going to discuss that in that video. That usually right after we take the pulse, we don't take our fingers off of the pulse. Instead, we'll start watching the chest rise and fall. And that allows the patient to believe that we're still taking their pulse. Meanwhile, we are now counting the respirations. And that keeps the element of surprise, which would keep their breathing pattern normal. 17. A patient's blood pressure is 180 over 110. What should the CNA do next? A, recheck the blood pressure in 5 minutes. B, lecture the patient about proper diet and exercise. C, notify the nurse immediately. D, encourage the patient to rest. That is right. When someone has a blood pressure over 180 over 110, oh, that is a dangerous blood pressure. They could possibly have a stroke if we don't get those pressures down lower. So, yes, you're going to notify your nurse. It is C, because that is a dangerously high reading. 18. Which of the following symptoms may indicate fever? Is it A, chills, B, sweating, C, elevated heart rate, or D, all of the above? Revealing the correct response in three, two, and it is D. It's all of that. That's right. Fever is often accompanied by chills. That's when they feel really cold, or they can break out into a sweat. So it just depends. And as the body is trying to regulate the temperature, the heart rate can rise. So chills, sweating, and an elevated heart rate are common things that we would see if a person has an elevated temperature, aka a fever. 19. What is the most accurate method for taking a core body temperature? Is it A, oral, B, rectal, C, tympanic, or D, say it with me, axillary? Not auxiliary. Auxiliary is a cord. Everyone say it with me, D, axillary. But that's not the correct answer. So 19 accurate method for taking a core body temperature. We need an internal temperature because this patient is really cold. Maybe they, were hypothermic because they were, out in the cold for too long. So we can't take an oral temperature. We can't take a forehead temperature. We unfortunately are going to have to do B. It's going to be a rectal temperature. So the rectal temperature is considered the most accurate method for assessing core body temperature. You have to be really sick for us to do a rectal temperature. So again, think of those extremes. Maybe someone drowned, maybe they're, really cold because they were outside in a cold environment. Think of things like that. And of course, more than likely, they are either on oxygen or they are unresponsive because we will try to do everything else before we before we perform a rectal temperature on an adult. 20. A post-operative patient has an oxygen saturation of 89% on room air. What action should the PCT take first? And for you all who don't know, a PCT is a hospital level CNA. So now you're in the hospital today. So your patient is post-op. They have an oxygen saturation of 89%. What should you do? Is it A, recheck the oxygen saturation? B, encourage deep breathing? C, apply oxygen? Or D, notify the nurse immediately? And this one's tricky because as you learn, as you get hired in different environments, you're going to have more responsibilities. Now, you still have to act within your scope of practice, but I'm going to need for you to do, hey, you got to recheck it. I know you just want to run out and go tell the nurse, hey, Nurse Eunice, the oxygen level is 89%. But they could be cold. It could be a lot of things going on. Maybe the finger probe is not on the finger correctly. So CNA should quickly check the placement of the finger probe to ensure accuracy before reporting. Applying oxygen is outside the CNA scope of practice. Okay, so you do not turn on the oxygen, but if they already have it prescribed, you can hand it to them. You can make sure it's positioned properly. But you will learn all of that because our goal for you is to go from CNA to whatever you want to do. which could be working in a hospital as a patient care tech, LPN school, RN school, respiratory therapy, physical therapy. Look, the door is wide open. We just need you to start. Let's go to our next question, team. Question 21. A blood pressure cuff that is too small can result in which of the following? Is it a false low reading, B, a false high reading, C, an accurate reading, or D, no reading at all? Look, I know you're busy, but you have a medium-sized cuff that you're trying to put on someone who is, obese. The cuff is too small. It may pop off, but what it's going to do whenever you use a cuff that is too small for your patient, it's going to do B, it's going to give a false high reading. So a cuff that is too small may cause a falsely elevated blood pressure reading, if you get a blood pressure at all, because oftentimes it will just pop off. 22. When should the CNA use the carotid artery to assess a pulse? Is it A, when checking for signs of a stroke? B, whenever a sleeping patient's arms are inside a blanket? C, in cases of suspected cardiac arrest? Or D, when the radial pulse is too fast? Think about the location of the carotid artery. It is at the neck. When have you ever seen a nurse or CNA feeling for the pulses located in the neck area? That is right. During an emergency such as cardiac arrest. So we teach you that during CPR. So the correct response is C. The carotid artery is used in emergencies. Otherwise, you're using the radial pulse. You're not going to go to someone's neck who's talking to you. You're going to go to their arm. So the radial pulse is used in emergencies such as cardiac arrest to assess the pulse because it is large and easily accessible, and it's also closer to the heart. So the body's going to start shunning. It's going to send blood towards the heart and the brain. And so if you need to feel for a pulse, that's the pulse you're going to feel for. The one that sits between the heart and the brain itself. That would be the carotid artery. Your body will allow your hands, your legs, your feet to not get as much circulation during an emergency. 23. A patient suddenly becomes confused and disoriented. Which vital sign change is most concerning? Is it A, a temperature of 99.1, B, a pulse of 102, C, an oxygen saturation of 88%, or D, a blood pressure of 138/82? And we're going all the way to 25. So I'm so proud of you all for studying with me, for reviewing your vital signs, revealing the correct response in 3, 2, and that's right. It is C. Oh, yes, because your patients, especially your elderly patients, they are so sensitive to lower oxygen levels. And lower oxygen levels can cause confusion. And you need to move fast, because if your patient was okay 30 minutes ago and now they're acting confused, it's like, hey, what's going on with them? Their oxygen levels could be low. And so that SpO2 reading of 88% is abnormal and dangerous. Report that to your nurse right away, but stay with your patient while you're waiting for the nurse to come. 24. A patient reports chest pain. How often should vital signs be monitored according to CNA responsibilities? Is it A, every 8 hours, B, every 2 hours, C, every 30 minutes, or D, as directed by the nurse? Yeah, that was an easy one for you all. You are right. Look, we're going to do them more frequently, but the nurse will tell you how frequently. There are blood pressure cuffs with frequencies, so you can actually set how often you want the blood pressure to be taken. So when your nurse says, there's an emergency in the room, your nurse says, hey, I need you to get the vital signs. The question you'll ask is, how frequently would you like for me to, have or perform the blood pressures? And you would literally press that number on your machine. So during an emergency, it is not uncommon for us to take a blood pressure every 2, every 3, every 5 minutes. Just depends on what's going on with that patient until they are stable. So chest pain is a medical emergency. Vital signs are monitored more frequently as directed, and changes must be reported immediately. I'm so proud of you. Let me tell you, this last one is a little bit different. Okay, let's look at this last question, 25. A PCT, aka a hospital level CNA, is caring for a 64-year-old patient who is 4 hours post operative following abdominal surgery. The PCT records the following vital signs. A temperature is 99.9 degrees Fahrenheit. The pulse is 160 beats per minute. The respirations are 8 breaths per minute and they are shallow, which means that you can barely see chest rise and fall. The blood pressure is 88 over 56 and the SpO2 is 84% on room air. I know you're like, Nurse Eunice, why'd you give me this patient? Because you're going to have some patients who are more critical than others, especially when you work in a hospital. But you're going to learn what to do. You're going to work with your nursing team. You're going to keep your patients safe. So now I want you to think about those vital signs. Which vital signs would you report to the nurse? And here's a recap of those vitals. 99.9 would be the temperature, 116 is the pulse, respirations are 8, blood pressure is 88 over 56, and then the oxygen saturation is 84%. Which are you reporting to the nurse? I'm going to give you about 10 seconds to put it in the chat. All right, 5, 4, 3, 2, and I'm going to use Ebonics on this one. All of them. All of them. You look, they all were wrong. I'm going to need you to get that nurse in that room like ASAP. Okay. So the patient is post operative, showing signs of hypoxemia, bradypnea, tachycardia, and they also had a low-grade fever. Look, get your nurse in the room. Those values could indicate oversedation from pain medication, respiratory depression, airway compromise, post-op blood loss, infection above your level. Get your nurse in there because this is a life-threatening situation that requires urgent assessment. Now, on your test, you're not going to have any questions like that, but I'm preparing you for more than just your test. I'm preparing you for the real world because once you pass your CNA examination, guess what? You're going to get a job and you're going to be in the hospital and you're going to be the difference You're going to be the one who reports those abnormal findings to the nurse and who helps to save a patient's life. I am so proud of you. Great job, team. Give yourself applause. You studied, you reviewed, you answered those questions, and don't forget that yes, you can download our Vital Signs Study Guide bundle, which includes this practice test. It includes a lot, an INO flow sheet, a Vital Signs flow sheet, a whole review. So it's loaded with information for $7. So you can either look at the link in the description area or you can scan a QR code on the screen. You can also go to our website or our YouTube store to purchase. And I appreciate you all so much. Remember that caring CNAs become caring nurses. You're doing this the right way. You're learning how to communicate, how to talk to the patients, how to talk to the healthcare team, how to turn patients. Everything that you're doing now is setting you up for success. You are going to be an awesome whatever you decide to do. And don't forget, yes, we have our channel membership. So our study buddies, $4.99 per month. It helps us to create this content. You all, it takes hours to create these presentations and slides. And so anything that you can do to support us, of course, we appreciate you. And finally, guess what? Thank you for watching. You did amazing. I'm so proud of you. And I will see you in the next video. I'll be checking the chat to see what questions you have. Bye, everybody.